Hey everybody, hi. It's Dr. Ellen Wood. I'm from IVFMD. IVFMD is one of the largest fertility practices in South Florida. We have multiple locations in Vieira, Naples, Jupiter, Boca, Cooper City, which is my office, and Miami. I am one of the 12 physicians in the practice, and I am here to speak with you, answer your questions with Dr. Duro, who is one of the acupuncturists who services kind of Miami and Dade County, and provides acupuncture services which complement our excellent fertility treatments that we have. So Dr. Duro is going to be joining me. I think she's going to do a request here. Let's see. There we go. As far as fertility and acupuncture is concerned. And we'll be so happy to answer those questions that you've submitted earlier and answer any new questions that come about too. Dr. Duro, welcome, welcome, welcome. I'm great.
Hey,
I managed to
hello,
figure this
how
out.
are you? Yay. I feel like it's been forever since we've done our last live. It's been a long time.
Like I just, my Instagram managers have been quite busy with school.
Oh,
However, my
true.
little one is she's got 2 tests left and then she gets a little break. So, so I've had a few more posts. Every time she gets a break, I get a couple more posts because again, she's better at this tech thing than me.
Yeah, yeah, it's not easy.
Well,
It's really not.
it's not easy and it's time consuming and then you do it wrong.
And hey, we've gotten off with like very few glitches, so that's good. Knock on wood.
So I did see we were sent. Well, actually, you know what? I introduced myself. Okay. I think I got everything in. My office is Cooper City. I've been there for 22 and a half years. Yeah, I think I really do a great job getting people pregnant. So
Yeah. Yes. And I've always tell people that when I met you, actually, we went to lunch one day. I remember I was just picking your brain about so many things. I'm like, tell me about natural killer cells. How does interlipids work? How does this work? What do you think? And then that was like probably like 15 years
that's
ago.
such
Now
a
that I'm thinking
great,
about
like,
it.
long relationship and have so many patients, babies, families in common. Yeah, it's really, it's just, when you look at how long it's been, it's just overwhelming and what a wonderful compliment your services to our services.
And vice versa. Yeah, definitely. I mean, and this is to me, the reward is just hearing it from the patients too. Like, and now seeing their teenagers, I'm sure you're probably going to be seeing their kids, you know,
No,
for fertility treatment. Then you're going to feel like really,
I
really
know.
doing this a long time.
Well, I have a patient now who, she's going to be trying for a second baby, but I helped her stepmother, okay, have her brother.
Wow. Oh, wow. Actually, yeah, I think I actually had a patient who said, my mom, Dr. Wood helped my mom conceive my brother. Maybe that was her. Yes.
It's kind of like, wow.
That's it.
Yeah, that's it. It just, because I still feel like I'm 25 again. So,
Yeah. Definitely. And you know, 50 is the new seven or seven, something like that. 50 is the new 30 or whatever.
so
We're good. And we have a few questions. I know that they're pre-submitted, and then for you guys who don't know me, my name is Farrar Duro, and I'm a reproductive acupuncturist. We practice in Hialeah Gardens. So we see patients from Broward and Miami-Dade and Palm Beach. We have some patients that live in Boca, some patients that live in the Keys. Like, they're kind of all over the place. And we'll work on every stage. So pretty much preconception to conception to pregnancy to menopause and all kinds of things in between. So we really love working on anything with women's health and reproductive health, and we work a little bit with pain relief as well. So endometriosis, PCOS, and all those things. So and we really like the integrative approach. So if if anything, we look at blood work from all across the board. When you guys go see Dr. Wood, we can peek sometimes in the Quest portal. We see all the stuff that's being done, and we're like, oh, cool. Okay, we can actually integrate this into the things that we do too. So, so it all works together, and we can communicate all together, which is really important.
So interesting. I mean, the reason that I started, you know, even investigating acupuncture was, again, there's only so far a lot of fertility treatments can go. I mean, it's like I've done everything that I've learned, everything that I know, everything that's out there. And then and prior to integrating the two approaches, I mean, I was like, well, I'm not really sure what else I can do for you. How about maybe you go and talk to the acupuncture people, because I think they do wonders with blood flow in patients with endometriosis. I think they can really, help patients with immunologic problems. And so I'd be like, I give up. And then I'd see the patient on my schedule and it would say she's for an OB ultrasound. I'm like, okay, cheat on me with another clinic out of the country? Or like, why are you coming to me for your pregnancy ultrasound? And so I go see her, so, hey, you're pregnant. Like, great. I'm
like, it's so surprising too when people respond sometimes to like things that we consider, okay, this is like a simple protocol, I guess you could say, but this is exactly what their body needed. And then, they also respond so well sometimes to IVF when they just have a little nudge sometimes, and maybe they haven't responded well before. So we just try to work on just maximizing everything we can.
People like, oh, the acupuncturist did this, this, and this. And I'm like, wonderful. You know what? Maybe we should do this, this, and this in conjunction with what I do. That's when it was, 3 years into my practice, I was just like, well, it shouldn't be them or us. It should be us together.
That's true. And that's awesome, because I know in some ways in that time it was kind of like, well, there's not, enough research. There's more studies needed. And then all the studies came out, and then some people were like, well, we need more studies. And honestly, I think that something that's non-invasive, there's no side effects to it. It has a lot of benefits as well, mentally, emotionally. That's a plus, I think. You're doing, first rule is do no harm. So, hopefully we can help people in other ways besides just, getting pregnant. We can go beyond that and work with them, throughout their pregnancy as well. But whatever you guys do, we just love to compliment that.
I think is actually really interesting. Okay, is that so? The large corporation that has acquired our practice, they have acquired she's a psychologist. I'm sure you're familiar with Ali Domar. So they have, she's now a part of our organization. She is currently recruiting for a study looking at the impacts of stress and fertility. And you have to be, it has to be your first IVF cycle. I mean, there's a bunch of little things on it, and I don't think the patient gets a, $3 gift card or something like that, like after they do it. But it's just, you basically, you wear a ring or something.
Oh yes, Dr. Pomelo was actually describing the study. That was cool.
It's interesting because even when she was talking about the study, she actually talked about the impact of alternative treatments, like the treatments that you give yourself. I mean, I'm an osteopath, so I believe that the needles make a difference. I think they stimulate nerves and stuff like that. I mean, I do think a big difference. But she was actually proposing that a lot of what acupuncture helps with is, although you're improving blood flow to the patient, you're also spending a lot of time with the patient. You're encouraging the patient, and from a stress standpoint, it's incredibly beneficial to have you on their support team. It's because the amount of time they spend with you, the amount of time it takes to do needles in and do the stuff that you guys do, it serves as a stress reliever to have an acupuncturist on their team.
Definitely. only that, I mean, that's, if you look at the studies with doulas, they're interesting in hospitals and it's very different, but they're there for support. And they found that the women who had doulas actually had less C-sections, way less C-sections. So their body, actually, the more relaxed you are, you know, the better your cervix can dilate. And you know that from working OBGYN, like it's like the mind and the body, the uterus have such a strong connection. And I think the same is true with fertility. So that's great when we can give support during a transfer even, or prior to that. Some people ask like how much time, that's always the treatment question, like how much time do I need to do acupuncture for? Like, it's kind of like, you know, I want to just make sure that I'm doing everything. So what do you know, what should I do? And I think that answer really differs for a lot of people, because certain people are going to have a lot more going on and maybe they need a little bit more treatment than others, you know. So our rule is kind of more like 6 to 8 weeks would be great if you can get that in. That might be enough time for your nervous system to kind of flip into that parasympathetic mode. And most people notice by 3 or 4 treatments that they're feeling a lot better with stress in general, like they're coping a little bit more. Things that used to bother them don't bother them as much, which is great for resilience, as we talked about last week. Like getting through an IVF cycle takes a lot of resilience. Going through another IVF cycle after a loss takes a lot of resilience. So like that's the mental part of it and emotional part. So I think that's really helpful. But you can definitely do it the day of your transfer. I mean, that's okay. I always say some is better than nothing. If you just do acupuncture that day of transfer, you've done something for sure. And you know, that's okay. And we, you know, would love to see you before that. But yeah, I mean, if your first time is with acupuncture to transfer, it might be, you know, you might be scared of needles. I don't know. We don't want to promote more fear.
So I think as far as a support mechanism, when preparing for a first embryo transfer, I think, you know, 6 to 8 weeks beforehand, because again, you know, we're given date. I mean, I'm given dates in July and August right now for my frozen embryo. So you have plenty of time to just get your body prepared. But I mean, I'm not saying before the first embryo transfer is a time to party, but it kind of is a time to party. I mean, kind of relax. You can kind of do a little bit more exercise. You can kind of be a little bit more liberal as having a glass or 2 of wine. I mean, you've made your embryos, they're frozen, they're already there. I mean, kind of just really try and say, and all the positive vibes, this is going to work. This is going to work. Like, this is going to work. And then, you know, kind of just, then you're going to like, all right, so I'm going to be pregnant, so I'm not going to be able to do anything for I mean, for at least the first 12 weeks of my pregnancy, because we take it all. I mean, you can do acupuncture, but you can't do much else. You know, and then we start giving you your privileges back once you start to get off the medications. But I think, you know, just from a blood flow perspective, from a stress, you know, mediation perspective, that, you know, to prepare for, as we're preparing your uterus with the medications, to prepare your mind with just a great positive mindset, can really, really be so beneficial.
Definitely. I think we're so overwhelmed. Everybody is, you know, so it's just 30 minutes out of your day, maybe once or twice a week, to really decompress. We actually take people's cell phones away. We're like, nope, leave them over there, disconnect, put them on silence. We have a sign in our, you know, our office, like, silence your phones. This is only 30 minutes. If there's an emergency, somebody will reach you, I'm sure. But I think we all need to do that sometimes. So this is kind of like your time.
All right. So let's see. We've gotten some questions that were sent to us, and maybe some more will be sent in. But we've got a couple questions. So natural cycle IVF. This is, I mean, again, natural cycle IVF versus medications. Which one is better? Okay. It's just a loaded question. Okay. Because the problem with a natural cycle IVF, okay, is that reproduction is all about numbers. Okay? We know that as sperm counts rise, pregnancy success rises. Okay? Up to about 10 million total mota with an IUI. Okay? It's all about numbers. So we know if you have more eggs, you can get more embryos. If you have more embryos, you have more chances to have a normal embryo. If you have a normal embryo, you have a higher chance of getting pregnant. Okay? So if we're doing a natural cycle IVF, and we're taking out one egg. It might make sense for the patient who has blocked fallopian tubes and who's 25 years old. So tubes don't work, or she doesn't have tubes. So maybe she's going to produce one healthy egg at age 25. Okay. But when you look at egg freezing data, okay, and so when we sell eggs to someone, so we have a 45-year-old who did not freeze her eggs, okay, and she's going to buy a donor egg. How many eggs do I have to sell her from a 25-year-old in order for her to have one healthy embryo and have a 60 to 70% chance of getting pregnant? I have to sell her 6 eggs, okay? When you're doing a natural cycle IVF, you're making 1 egg, okay? But I got to sell somebody 6 eggs to get her pregnant at a really good pregnancy rate. So if you're 30 to 35, how many eggs do you need to get pregnant? You need like 10, okay, to have a good chance of getting pregnant, okay, with eggs. So you're doing natural cycle IVF, you're making 1, maybe 2. Now, there are patients who I can give them $500 worth of medicine a day, $800 worth of medicine a day, and they're only going to make 1 or 2 eggs. Okay, well then natural cycle IVF makes sense, because again, the medicine's not going to do it. Your body's just going to do it for you. If I have a patient who's 35 to 39, 40, I need, like, honestly, 15 eggs to have a good chance of making 1 baby. So this is where natural cycle IVF doesn't make a whole lot of sense, because you're going to have to do a whole lot of natural cycle IVFs, okay, to get enough eggs to make it equal the success rate of a medicated cycle. But if you have a very low AMH and a very low diminished ovarian reserve, and you're only going to make 1 or 2 eggs, well, yeah, again, there's an argument for a natural cycle or like a mini stim type of cycle, because again, you're not going to make, no matter what I give you, you're only giving me the certain amount of eggs. So, but you have to, usually when we're looking at eggs, it's a pure numbers game, and that's where the natural IVFs, like I think there was a study done years ago, you have to do 3 natural IVFs to equal the success of 1 regular IVF, and that was out of Europe, because they do. I mean, some in Europe, because it's not, there's not, it doesn't cost as much. But a natural cycle IVF is usually going to cost, from the doctor and from the lab perspective, the same amount. You're just going to save on medications. So when you compare the things, you have to compare apples to apples and apples to oranges.
Well, that makes sense too. And I mean, you definitely want to look at, I guess, the amount of DNA issues that perhaps could be occurring in the sperm, right? And as somebody asked about, does DNA fragmentation affect creating healthy embryos? Would you say that has a big role, or just a minor?
It's huge. I mean, the problem is a regular semen analysis does not detect DNA fragmentation in sperm. So you can have a gentleman with great count, great motility, even normal looking sperm, and say he's smoking, or say he's vaping, or he's doing a little marijuana, or he's doing a little bit of something else on the side, and he's like, I'm fine, I have a normal semen analysis, okay, I don't have to stop smoking.
Right. You hear that all the time. Like I'm healthy.
I have a couple that literally semen analysis right down the money, perfect. Okay, using a donor egg. Okay, so things didn't go well with the first donor egg cycle. She wasn't proven, so we weren't really sure whether that could be an issue. So the second time we try, we get a proven donor egg. So this egg from a 25-year-old girl has made babies before, okay? I combine proven donor eggs with husband's sperm that looks perfect on semen analysis, and everything died. So I said to the guy, I'm like, I need to check your DNA fragmentation, because something's not right here. It's not the egg. It's not the egg. This girl has babies before. I checked the guy's DNA fragmentation, off the wall high. I'm like, oh my God.
I mean, this is tragic. I mean, but his semen analysis, perfect. Oh,
That's frustrating. They should do this on everybody, I would think. Like,
you need to quit smoking. And he says to me, don't tell me what I have to do with my body. And I'm, well, if you want your wife to be pregnant, okay, I think this is what you're gonna have to do, because the egg bank will reimburse you a fresh set of eggs, because everything died in the dishes. So the egg bank we used said, if your eggs don't make it to blastocyst, you can have a fresh set of eggs. No, so she has eggs.
Nice.
And I said, no, I personally am not using your eggs until your DNA fragmentation is normal. Not doing it. You want to take your free eggs somewhere else and let them do it? Fine. Okay. But in my opinion, okay, your sperm was the cause of this, because for some reason the DNA was compromised by an external habit you had. And my brother has kids, my father has kids, that one has kids, and they all smoke. Well, you're genetically inferior. Okay, I don't know what else to say. So, as far as fixing DNA, antioxidants, getting rid of medication or a habit that may be causing the DNA to be fragmented is where we start.
I like, I don't know what you think about glutathione, but it's really, I love it for male issues too, like just working with DNA fragmentation and, you know, antioxidants especially, but you can check those levels. We actually checked someone's earlier this week and we saw it was extremely deficient in glutathione. And that person's been having egg quality issues. So I think it's nice to look at that and say, okay, we can directly help. You know, we have many forms of glutathione we can use. We can see a correlation when it really goes up, that they respond better. They have improvements with sperm and egg quality. So we try to get both of them to actually start, you know, working together on a plan, obviously changing the diet, you know, helping with lifestyle, like you said. And, you know, getting that checked, because, yeah, if you're just going to go to a random semen analysis, you might not pick up on that. They might not order that. So that's why they need to go to a fertility clinic, really, to look at that.
We're not working, you know, the patients who come to us, unfortunately, are not normal. I mean, it's frustrating, because all we see is patients who are having problems. So I always have to constantly remind myself, 85% of the population is fertile. Okay. And the residents that I work with from Mount Sinai, who rotate through our office, and, you know, I try to teach them reproductive endocrinology and infertility treatments, so they can go out there and be educated OBGYNs. You know, they come into the office and they're like, who are these people? Because when you are in OBGYN residency, and this is the majority of your OBGYNs out there, okay, all you see is babies. People are just getting pregnant. They didn't want to be pregnant, okay? They're preaching birth control day in and day out, okay? And these patients are not on their radar. So and they're delivering patients who are unhealthy, with unhealthy BMIs, who have an unhealthy diet, of unhealthy this. So again, we're not saying that people who are unhealthy can't get pregnant, but the problem is you can't get pregnant, okay? And because you can't get pregnant, we have to look at these issues, because we get pushed back on patients. Like, you know what, your BMI is healthy, you've got a little bit too much, you know, body fat, and it really benefits you, you know, to lose 5%. Well, my friend is the same weight and she just got pregnant with her third kid. It's hard. It's hard because, you know, you try to educate that this could be the underlying cause of your problem. And if we corrected these underlying health issues and, you know, improved, you know, the different aspects of your life, you might not even need to pay me expensive treatment to get pregnant. And again, it's just very hard to, I mean, I find it difficult, because when you look at the other side of it, and there's so many patients out there that, you know, nobody had this person, didn't have a patient problem, this patient problem, and she is, you know, looks the same as me. That's not you. Or, you know, my semen analysis is normal, but, you know, my brother had babies he smoked, he has 3 kids. Not you, you know, and you have to, everybody's DNA and their genetic makeup is different. You know, my ex-husband's grandfather smoked for 50 years and died of causes not related to smoking at 9. I mean, it's like, you're genetically superior. This doesn't bother you. But, if you're having issues and you have lifestyle issues, we like to address those first. And we have lifestyle consultants in all of our South Florida offices who will work with patients from looking at their glutathione levels, looking at, their health, looking at their dietary patterns, looking at their weight. And they try to optimize all of those things before they'll say, yes, you're ready for Dr. So-and-so to take you through, an IVF treatment. And I think there's a lot of practices out there that, yes, they're aware of these health issues. Yes, but it's like, I'm the fertility doctor. I'm not the weight loss doctor. I'm not the family medicine doctor. I'm not the one who looks at your cholesterol. I'm not the one who looks, this level or that level. I'm just the one who goes and gets eggs out and makes embryos. And if the embryos die, they die in the dishes. Or you don't get pregnant, you don't get pregnant. Again, I think our practice from a lifestyle and a holistic perspective, I think we differentiate ourselves a lot from, the competition, basically, because, yeah, you come to me like, look, I need to do IVF. Okay, great. You need to do IVF, but you're not doing IVF with me until you fix this, you fix that, you fix that. Okay. I had a patient who, I told her she needed to do this, this, and this. And then she went to another practice and they're like, nope, you just need to do IVF. It was a disaster. She comes back to me and I'm like, I said, great, you're willing to pay me whatever amount of money it is we charge for IVF, which is a lot. I mean, and she paid them. I'd say, you're willing to give me the money tomorrow for me to start you with IVF. I will say no. I will say no. Like, no, terrible idea. Like, my goal is to make you have a baby. Okay. It doesn't, and again, granted, the people who employ me probably aren't happy about that, but
that's how you guys stand out. And I mean, wonder if,
I mean, and you talk to physicians in other practices like, well, don't patients leave you? And I'm thinking, okay, if they leave me and they fail elsewhere, they'll say, yeah, I should have listened to her. And I've had it happen multiple times, especially with the killer cells. I was thinking about that today. I have a patient who she did 3 frozen embryo transfers with another practice. Okay. She did 2 of them, they failed, or she had a miscarriage. Okay. She came to me, I tested her, she had the killer cells. Okay. I'm like, look, you need to treat. Okay. She's like, yeah. Okay. She went to the other practice, did another frozen embryo transfer. She failed. Okay. She comes back to me after 3 failed transfers and she goes, all right, I give. Okay. She had tons of normal embryos. She goes, I give. I'll take the killer cell medicine. Okay. She currently has a baby.
Oh, we've had so many patients like that. I'm like, please just do it. It's not going to hurt you.
She failed 3 times somewhere else. And I'm like, look, I really think this is your issue. Like, I really think this, I mean, and it's a crazy issue. I mean, honestly, it's a crazy, crazy issue. And I wish we had a control group that we could use, but it's just not.
Nobody wants to be in that control group.
To actually validate, the 20 years of experience and we have with this. But when you come to me, I'm like, look, all I can tell you is anecdotal story after anecdotal story after anecdotal story, and I have like hundreds, probably thousands by now after 20 years. But it's just, it's a really interesting problem that is not well studied and not well published and is only treated, I have to say anecdotally, as an adjunct to our standard medicines, okay, as our standard fertility treatment. And again, this is also something that has not been well studied with, your type of medicine with acupuncture. So we don't have great, it's like, you have to see a patient with the same age, the same problem, blah, blah, blah. You get acupuncture, you don't. Like, it's just so difficult to do in these very high stakes treatments because, I mean, you kind of do it, I guess it was free, but still there's the emotional component to it that really, you know, screws people up. Even if it was free, people stop treatment after 3 or 4 cycles.
No. And you're talking
Yeah.
about people with multiple miscarriages that would not want to be in the placebo group. And I think that is very difficult. But I wonder if you guys ever measured your miscarriage rates, if they would be lower than other clinics, because I feel like they are, like just from seeing, you know.
It's just too hard to do. I mean, I'd love to, but nobody wants to be in the control group. So it's again, I mull it around in my mind, and the reason I do is because if you have a resident with you, they ask you all these questions, you know, and the resident's like, well, why don't you do this? Why don't you do that? I'm like, well, it's not that easy, you know, type of thing. Common is to have DNA fragmentation tested. Why isn't it common to check with semen analysis? Because it's expensive. That's why. It's expensive. And if you did it on everybody, I mean, semen analysis is like $100, $130. I mean, a DNA fragmentation test, I think, is like $300 or $400. We do have some physicians in our practice, not myself, but we do have some physicians in our practice who do recommend it on the majority of their patients. Okay. I try to, let's say, practice medicine in a cost-effective approach. So if I think there's a risk factor, or I think the history warrants doing a test that is expensive, then I'm going to recommend it or order it. Or if I have an outcome that is not what I think it should have been, then I'm going to look for a zebra. But in general, a DNA fragmentation test is more of like a zebra, more of a kind of an outlier. Mm-hmm. But we do have physicians in our office, and again, I'm fine with it. I mean, some people, you know, before they take a patient through, they want to test, you know, everything under the sun, even though their yield on getting a result may be 2% of patients. So you test 100 patients and 2 are positive. That's not really the way physicians are trained as far as practicing medicine is concerned. So when we practice medicine, we're taught what is the yield on a test that we're going to get a positive, and you know, if it's lower than a certain percentage, we should not do that test.
Yeah, that makes sense. And I mean, talking about optimizing things, I think in general, though, what about a male fertility supplement? Just, you know, as an insurance thing, like here, you know, take something as a precaution.
That's pretty much what I do. So if I see any little blips on a semen analysis, so I see the morphology is not good, and the only way to really correct DNA fragmentation is to, again, look at habits, look at medicines. Look, if you smoke and your DNA fragmentation is bad, you need to stop smoking. You need to stop marijuana. You need to stop vaping. Right. Okay, you need to stop drinking so much alcohol if your DNA fragmentation is not good. So if we see it, yes, we can correct it. In general, we make those recommendations right off the bat. Like, okay, it's not good for your sperm, right? But my sperm look great. Well, it may be affecting your fragmentation. And then the only things we really have to try and make the sperm healthier is, again, get rid of the underlying cause and fertility vitamins. So we are very liberal as far as recommending male fertility vitamins. You know, I recommend a Coast Science male fertility vitamin. There's also FH, same thing. Antioxidants in general, you know, are good for sperm. So you don't have to buy those particular products. I like those products because they're easy, and they're just easy. Everything's in them. You know, they have science behind them. I mean, I think they're made by reputable companies. I mean, I think they're good vitamins, but they have all the antioxidant ingredients opposed to buying a bottle of this and a bottle of this and a bottle of this and a bottle of this. So again, I do like, you know, I do like those products. And again, you know, men say, what can I do to help my sperm? And sometimes a guy, I say, well, your sperm look good on paper. I said, but these vitamins won't hurt you. If, you know, you can tolerate them, they're not bothering you, they're only going to make your sperm healthier, you know, even if we have issues on the cellular level.
And meanwhile, the female partner's taking, like, you know, a huge cabinet of things. Like, okay, here's a ton of supplements I'm taking, and then this is all we're asking is just a, you know, multivitamin pretty much for the guy. But I think it can help, you know, in general too. And we did have a question also about vitamin D. And as we're talking about optimizing things, like I know we talked about vitamin D before. Like, what are the
Okay,
levels
so
that you like to see
vitamin
as
D.
far as optimally?
So low vitamin D levels have been associated, they're associated with patients with autoimmune infertility. Okay, so that's one piece of it. Okay. So to optimize vitamin D levels into the 40, even up to the 50 range in patients with some sort of autoimmune problem, okay, whether it's reproductive loss due to killer cells, reproductive loss due to positive antinuclear antibodies, reproductive loss due to antiphospholipid syndrome. So reproductive loss due to an immunologic problem. From the reproductive standpoint, I like to optimize vitamin D into the 40 to plus 50 range. And that's been recommended for patients with just autoimmune disease, rheumatoid arthritis, lupus, psoriasis, like all sorts of autoimmune diseases, okay?
I noticed PCOS patients have very notoriously low levels.
Live in Florida, go outside and sit out in the sun for 10 minutes a day, but levels are pitiful in 75% of the patients I test, okay? My main motivation, and which is why I started testing vitamin D back, oh God, I've been here too long, 15 years ago, is because of pregnancy. So my entire goal is to optimize you and to make your body as healthy as possible before you get pregnant. Because for some reason, and I can't explain it, I can't explain the physiology behind it, they've just done studies that have associated it. Patients with low vitamin D levels have a higher incidence of preeclampsia. They have a higher incidence of gestational diabetes, which makes no sense, but it's been reported. They have a higher incidence of preterm labor. Like, huh? Like, really? I mean, like, why would you preterm labor if you're low vitamin D? I don't know. It may be a lifestyle. I have no idea. Okay. These associations have been made in the obstetrical literature. So when you look at OB studies, patients with low vitamin D levels, higher incidence of this, higher incidence of this, higher incidence of that. So I'm thinking, well, they're not pregnant when they see me. That's when I started to say to myself, well, I probably should check them for vitamin D. Like, because I want them to have healthy pregnancy and I don't want these bad things to happen to them when they're pregnant. So let's get their vitamin D before they get pregnant.
Yeah.
So it doesn't have done IVF studies, egg quality studies on vitamin D. Does not seem to make a difference. Okay. Low vitamin D does not seem to be associated with poor egg quality. It's been done. Like, it just doesn't seem to correlate. But I still try to optimize vitamin D for pregnancy. Okay. And there is some autoimmune component to vitamin D that may, optimizing it may help their immune system in some form or fashion. But we don't have that specific link. So this is why we try to optimize things. The same as the thyroid. Okay. So your thyroid levels between 0.4 and 4.5 is fine. Okay. You don't need thyroid medicine. But if you want to be pregnant, we want your TSH level, your thyroid stimulating hormone level, to be between 0.4 and 2.5. Okay. So if you're not trying to be pregnant and your thyroid's 3.7, you're good. Okay. If you're trying to be pregnant, we're preparing you for pregnancy. If you don't want to be pregnant, you don't need thyroid hormone. But if you're trying to be pregnant, we're trying to get your body optimized. It's the same premise as we test to make sure you're immune to German measles, rubella, and chicken pox before we get pregnant. Okay? Because if you're not, we don't want you to catch those things when you're pregnant, because they can hurt you during pregnancy. They can cause birth defects. They can make you extremely sick. They can hurt your baby. So if you're not immune to German measles and chicken pox, which can be catastrophic in pregnancy, get a vaccine before you get pregnant. That's why we do genetic testing. If you know your husband carries cystic fibrosis and you carry cystic fibrosis, I want to let you know that, because you have a 25% chance of getting pregnant with a baby with a disease, cystic fibrosis. Now, your choice to play the genetic lottery. Okay? Your choice. If you want to say 75% chance, I will be good. Okay? But if you don't want to play the genetic lottery, I have incredibly successful treatments that can test your for that disease, okay, before I get you pregnant with the bag. So you don't have to make that decision at 14 weeks pregnant when the doctor tells you your CVS came back and your baby's affected with a disease. Do you want to terminate your pregnancy? You don't have to go through that. We just don't even, you say, look, your embryo has cystic fibrosis. Okay, I'm not putting it back. It's a terrible idea to have a baby with it. Okay, but if you decide not to do treatment and you have a disease, okay, you've been educated. You talk to a genetic counselor, and we send all our patients to genetic counselors, and then you can decide, okay, whether you want to play the genetic lottery or you want to go the extra mile and try to do a treatment that will prevent you from having to make that decision when you're pregnant.
This is even more important now, I think, with all the laws and
but again,
changing.
I mean, I know I digressed from vitamin D to thyroid to genetic disease, but it's the talk I have with patients every day. Looking, I have you hostage right now. You're not pregnant. I'm going to have to offer you some sort of fertility treatment, whether it's fertility treatment A, fertility treatment B, fertility treatment C. Okay, but you are not pregnant now. So I have the ability to make you as healthy as possible before you get pregnant. I have the ability to educate you on what the risks are before you get pregnant, and then you can make your informed, educated decision, okay, on whether we want to wait and correct these things. Okay, I mean, it's just, I mean, I'm in such a unique position as a fertility doctor as opposed to the OB when you're like, oh, we're pregnant. Okay, great. And they show up and like, all right, well, your hypertension is not controlled. Carry this gene. This level's low. You're anemic. Oh, the anemia. Yeah. Oh God. Yeah. I'm an anemia expert now. I mean, like, your hemoglobin is 9. You should not be pregnant. Okay. You are going to feel.
Yeah.
You need to fix your iron levels. You need to fix your anemia before you get pregnant. I would be doing you a major disservice if I were not to correct your anemia before I got you pregnant. Okay? Because I know about it and it's easy to correct. Mm-hmm. I can send you to a hematologist who will, raise your iron levels and get, help you in 2 months. He can have you in, or she can have you in great shape. And now you're in a healthy place to be pregnant. Oh,
and what about insulin resistance? I mean, you can fix that. You're going to do really well
lower
in
the risk of
pregnancy,
gestational diabetes. Just again, I come at this whole medicine thing from a health perspective as opposed to a, yes, all right, well, you're not healthy, let's do your IVF cycle. Doesn't matter. I just want to get you there. I'm the fertility doctor. I'm doing the IVF. I don't really care about the rest of your body. All right. My soapbox sometimes, but it's so frustrating because, like, this is the way I was trained was, health first. And then many times you get the patient healthy, they don't even need the fertility doctor.
Yeah. No, that's true. Preventative medicine for sure.
Kills the business. I mean, I talk to a patient, I do this, I fix that. They get pregnant on their own. I'm like, look, they're in an IVF cycle. Not gonna like me.
Well, I think that, people actually realize when they feel better, they're actually going to have a healthier pregnancy in general, and they'll come back to, afterwards, sometimes you can get pregnant on your own after IVF. You don't even need it. And then sometimes you need to prepare. You've got, embryos banked and you want to optimize that next cycle. So
levothyroxine in pregnancy.
So
absolutely. You need to take the levothyroxine during pregnancy to keep your TSH less than 2.5 to make sure that your baby's brain is developing properly. Okay, no, that's, yes.
And
miscarriage as well, if you have thyroid
right,
antibodies. Sometimes you have antibodies against your thyroid and you need to take a little bit of Synthroid in order to optimize your outcome. I take 18 pill, that's funny. Does that include PCOS? Let's see here. Sorry. I get on my soapboxes and
Well, thyroid medication and the levels are still high. You've got to make sure you're getting those checked regularly and going to your endocrinologist.
If the thyroid is out of the normal range, it's going to cause ovulatory problems. Okay.
Yes.
So So we have to talk about thyroid in the optimal range. So if your thyroid is between 0.4 and 4.5, it shouldn't cause ovulatory problems. Okay. We only want it less than 2.5 for the health of the baby. So you have to quantify what is high. So if your thyroid level is like 8, okay, well, it's going to cause ovulatory problems. And like the treatment is not to give you a fertility medicine. The treatment is to lower your TSH level. Okay, so you have to quantify high, because again, there's high that causes ovulatory problems, and there's high that may affect the health of the baby in the future.
And I mean, sometimes selenium is good, and just, also cleaning the diet up a little. If you've got Hashimoto's or antibodies, some people, think, eliminating gluten can be helpful. So, but yeah, working on all those things and then making sure you get your levels checked. So we get that question a lot, like, can I just treat it naturally and not take thyroid medication if I'm trying to get pregnant? I'm like, I wouldn't take that risk. I mean, I think, this is really important
10%
to
of
make
women
sure
are
you
on thyroid
maximize your.
medication. It's very, very common to have the thyroid not like work great. So it's
Once you get pregnant, it can really affect it. I mean, the TSH can shoot right up.
it's a very interesting endocrine organ. Right. So I get a question here. How long does one IVF cycle take? Retrieval, genetic testing, and transfer. So in general, it's a good 4 months. Okay. It's 4 months the whole treatment, 2 weeks actually doing the treatment, and then 2 to 3 weeks waiting for the results of the genetic testing. Okay, great. We get good genetic testing. Then it's going to be another couple of weeks to prepare your uterus and, do the uterine testing, do the immunologic testing to make sure that's all good. And then a preparation cycle to to transfer the embryo. We have to prepare your uterus with hormones, estrogen and progesterone, to make it receptive for the embryo. And then we replace the embryo, and then it's 10 days to a pregnancy test. So the minimum we can squish it into is going to be like literally 4 months. And that's squishing, that's doing everything right back to back. Okay. The prep, the consents, the this, the that, all that stuff. So again, and again, it can be done in that time. It can be done in that timely fashion. It's just the patient has to be on top of, I got my blood drawn at the right time. I came with a period. I had my insurance authorizations. I had all the stuff done. So it can be done. You can go from, yes, I'm starting the treatment, to, hey, I am pregnant in a 4-month period of time. Some people 5 months, some people 6 months, because we run into little stumbles and roadblocks along the way. Patients have a growth in their uterus has to be fixed. Patients have an infection in their uterus has to be fixed. Sometimes there's little, bumps along the way that have to be fixed to optimize the chances that the embryo is actually going to take.
Yes, for sure. And there was also a question about yoga before and after IUI. I was just looking at our questions about that, and I love yoga, but
5 degrees in a room. No.
Not hot yoga, right? But I think regular yoga would be, or
all
hatha.
that stuff. Yeah. I mean, I think that is incredibly beneficial. But
for sure. Just making sure we got to our questions here. And how often do you recommend going as a pregnant patient? Which I think it would be, referring to acupuncture, I would think, because no more IVF at that point. But, I think, in general, we usually see patients in that first trimester for, like we talked about, prevention of nausea, vomiting, helping with that. If you do get a little queasy, it's really good, actually. There's a lot of studies about nausea and acupuncture. And then we work on, anything like migraines, back pain. You're going to be a little tired. That's normal. Actually, we've been working on a lot of sore booties because of the progesterone shots. So, so we have like little help with that. Sometimes we do a little massage, prenatal massage, that sort of thing is good. And injection site pain is just one of those side effects sometimes that you get from the progesterone injections. But sometimes if it's really bad, it can turn pretty inflammatory. So we do a little sometimes support for that. And then, we don't see patients back usually until like the very end if they want to do some, you know, supportive treatment like pre-birth and that sort of thing. But it's pretty much as needed during the second trimester as well.
I mean,
Yeah.
I think from the nausea and vomiting perspective, I mean, I've really, really had patients who medication, you know, are okay, and they really didn't want to really through it,
Yeah.
you know, phenomenally. So I can't say enough about the benefits of acupuncture, especially for the first trimester, which can be hard on some patients.
Yeah. Yeah. And I remember we talked about this like with COVID where we were closed and then, you know, we had, I think 6 pregnant patients and we didn't see them at all for acupuncture and for that month. And and I was calling you going, what do we do? Because everybody's, you know, the OBs, it was hard to get in with them. And, you know, they were, you know, and we usually don't see that many people vomiting actually. When we're doing acupuncture, it's like, okay, it's like, actually, do you feel anything? No, I don't feel anything. Is that okay? That's good that you don't feel anything. You don't have to feel sick, you know, it's fine. So, but we realized how much it did influence that. So, so that's why we still, before we even see the pregnancy test, we're still doing those.
So interesting question here. Can someone try to do IUI, to try naturally do IUI during the 4 months, or that have a negative? You know, you can't do that. No, you can't do that. Okay, because there's certain protocols we have. So you're going to start an IVF treatment with your period. Okay. So before you get your period, you need to order medications, sign consents, do an injection class, get medication. Okay. So yeah, sure, you can try. That's fine. You're not on any meds. We're just waiting for your IVF. And if you get pregnant, great. I mean, sometimes that happens. Okay. IUI, because you're already, you know, going to do an IVF cycle. And then after you make embryos, normally we'll want to kind of put your ovaries to sleep or downregulate your ovaries so they're not working in order to prepare you for your frozen transfer. So you're not ovulating, so you really can't try to get pregnant because we're trying to control of your doing treatment in between. It kind of is counterproductive to what we're trying to do, because we need to, when we're stimulating you, we need to take control of your ovaries with medication. And preparing your uterus for embryo transfer, we need to put your ovaries to sleep in order to get your uterus to be receptive for the embryo. So really do the two things together, because we're doing other stuff that are messing with your ovulation. IVF is not cheap. How much does IVF cost? I mean, out of pocket, you know, we're talking anywhere between $12,000 to $18,000, depending on what package you have. I mean, there's packages you can get unlimited stuff for, I think, like $30,000. You can get 3 retrievals and unlimited transfers and stuff like that. I'm not the money person. Again, it's not inexpensive. However, for the yield you get in general and the success rate you get, it's worth its weight in gold. From a time perspective, from an emotional perspective, from, you know, just month after month after month going by. I mean, it's like we've been trying for 4 years. All right, we'll do an IVF cycle. You have a 65% chance of having a baby, you know, after 4 months of treatment. I mean, again, it's not 100%. I wish it was. My job would be phenomenal if it was. But I think from an efficiency perspective, IVF is a great option for patients who have tried for more than a year, patients who are over the age of 35. You know, from an efficiency standpoint, it is really an excellent option to say that, hey, what do we want? A baby. Okay, all right, this treatment will help you have a baby. I'm not saying you can't have a baby with IVF and then get pregnant on your own. Like, that happened to the guy who owns our company. Like, that's why he owns our company, because he had trouble. He needed IVF to get pregnant. He didn't feel his IVF experience was great and decided, I'm going to buy IVF practices. But apparently he used the technology to get pregnant with his first child. And then his second child was, surprise.
Yes.
they
That
factor
you hear
play,
quite a bit too. It's hard.
but
And
the experience he had was not the greatest one. So he wanted to try and improve that experience for other patients who were having the same difficulties. And
Mhm.
so that's what he's trying to provide, you know, Canada, the United States with, you know, a better experience into family building and things like that, based on his own experiences. Because this, I mean, nobody really wants to do this. It's not fun. It's a means to an end. Okay, and at the end, you forget what you had to do to get there. But
Yeah.
we try. I mean, we try to do it. I think in our practice, from, you know, a health perspective, from a wellness perspective. Even we try to provide patients with their best financial options, from providing them with options for multi-cycles and you know, transfers. If this doesn't work, look, you don't have to pay again. We'll do multiple transfers for you, cost, you know, to decrease the financial burden. It's patient try and perspective, which we try to deliver. Unfortunately, again, we're really busy, and again, I mean, I wish I could call every patient personally and do everything. So that's why we have a nursing team who does that. But I mean, I think, you know, we try to, you know, deliver optimized care, and we're going to be most successful if we optimize the patient's health beforehand, in conjunction with lifestyle coaches, in conjunction with acupuncturists to decrease stress, with acupuncturists to improve blood flow to the ovaries. I mean, all sorts of things like that. So again, IVF's not cheap.
No, and some states actually do mandate coverage, but unfortunately, Florida is not one of those. But it hopefully will change one day. I mean, this is definitely
Surgery for endometriosis improves the quality of your follicles. That's a toughie. In general, no. Endometriosis surgery might improve your chances of becoming pregnant, because it reset your immune system and make your body friendlier to sperm, make your body friendlier to embryos. But the problem is, endometriosis surgery is not efficient as a tool for helping people get pregnant. That's been studied, published. I mean, in one study, you have to operate on 12 patients for endometriosis in order to achieve one pregnancy without IVF. Another study, you have to operate on 6 patients to achieve one pregnancy without IVF. So in general, they have pretty much said, stop operating on people. You're wasting their time. You're subjecting them to general anesthesia. Okay. And unless the patient has severe pain that you're doing the surgery for, do not operate on somebody just because they're not getting pregnant. It's not efficient. It's not an efficient way to achieve pregnancy. And our whole goal as fertility doctors is, at least my goal is, we don't have to have a long relationship. Okay. We get you pregnant and send you on your merry way. Send me a birth announcement and a picture of your baby. Bring them back so I can take a picture. But
yeah, that's true. I mean, we haven't seen as many, like back in the day, there's lots of laparoscopies and people would go in for surgery all the time.
Everybody. So I'm not aware of programs that'll assist with funding for IVF. Unfortunately, I'm not into the finance part of it. All I know is that our financial team has excellent resources as far as financing. We have multiple different financing options that our financial team can provide patients with through family something or other, lending club. I mean, there's so many out there. So we didn't have a ton of questions, but I'm glad. Hopefully, I looked at the feed. I hope we got the ones that you know, were most important. Hopefully, we got them mostly done. I just want to, if anybody who's listening who has babies from us and is been invited to our Mother's Day party on Mother's Day next weekend, I'm unfortunately not going to be there. We haven't had a Mother's Day party since pre-pandemic. And so before I even knew we were having a Mother's Day party, because I didn't know it was going to happen again this year, I am going to Boston to spend Mother's Day with my daughter. um,
Nice. I'll be there next month, actually. I'm going for 4 days to University of Massachusetts. Some young future medical leaders with my daughter, so
again,
we're gonna have fun.
I mean, you know, prior to pandemic, I always tried to be in town on Mother's Day, you know, because that is one of the joys of my job. I mean, it is one of the most wonderful joys of my job is to actually see the babies we've made. I mean, and I'm so glad that, you know, since this awful pandemic is over, we've had patients being able to come back to the office. I've been able to take pictures with patients. I've been able to cute babies. I mean, like, oh my God, I made the baby. Like, you know, and I am, my memory is like an elephant. I mean, I know in my head everything that patient went through to get to that point to have the baby. So, I mean, that is one of the major joys of my job is to actually have, you know, see the babies. And I've had patients who bring back to me like 15-year-olds, 18-year-olds. I'm like, oh my God, this is kind of scary. Doing this for so long. But I mean, I love to see the babies. However, I planned this trip to Boston, you know, a couple of months ago, with my daughter, and we're doing, you know, mother-daughter things like for Mother's Day. But prior to the pandemic, I was always trying to be in town on Mother's Day because of this party. So if anybody is on, you know, is listening tonight and they're planning the Mother's Day party, I would love to meet you. Unfortunately, I'm not going to be able to make it this year. I will exit out on my calendar since we're bringing the Mother's Day party back, which is one of the you know, it's one of the greatest rewards that I have in my job is to see all of the families that I've helped build.
Yeah, definitely. And yeah, please, Dory's chiming in. We would love for you guys to just stop by too. Now that no COVID restrictions lifted, like we love seeing you guys in person as well.
But if anybody's on here, I've made you big. I just, you know, call the office, let us know when you're coming by. I would love to take a picture with you and just meet Little Miracle. It's why I go to work every day, like, because the job is so fun.
Yeah, the best job.
So anyway,
in the world.
thanks everybody. Thank you, Dr. Duro, for you know, adding your input, helping our patients. You know, I really appreciate everything that you do as you know, a treatment that complements what I do every day.
Yeah, and the same. Yeah, you're the best. So we really appreciate you as well. And thank you guys for all your questions. We hope to hear from you. You can follow us on Instagram or at FL Complete Wellness. And also you're at Dr. Ellen Wood. So pretty straightforward. So, all right. Well, thank you, Dr. Wood. And we'll see you soon. Good night.